The province's online gambling market is offering more options. Private companies can now operate internet casino games and single sport betting. Well, single sport betting has been allowed in Canada since last year, but only the OLG was allowed to do it legally in Ontario. The new gambling industry is expected to create 1,300 jobs in the province. For more on this, we're joined by Dave Briggs. He's the managing editor of PlayOntario.com. Nick Sulsky is the COO at PointsBet Canada. And Nigel Turner, he is with the Institute for Mental Health Policy Research at the Centre for Addiction and Mental Health, CAMH, as it's known. Thank you all three for being here. What a day. This launched at midnight. Thank you all for being here. Nick, let's start with the basics. What do Ontarians need to know about this new regulated industry and why this new industry? I mean, how much demand in the market is there for this?
Thanks for having me, first of all, and it's a pleasure joining the other panelists. As far as the interest in the category, it's quite significant. Over the last number of years, there has been roughly $14 billion worth of single event sports betting in Canada in the gray and unregulated market. So being able to bring single event sports betting into a regulated framework provides opportunities from legitimate premium operators like PointsBet Canada to offer the safest, most secure opportunities for Ontario sports fans to gamble and gamble responsibly.
So
it's
Nick, go ahead.
Please, I'm sorry.
No, this is great. I was going to say, so what do people need to know? Because you're saying this is a massive industry in terms of the appeal and the market and the demand and interest. How does someone know when they jump onto a website like yours that you are a legitimate industry versus, a gray area?
I think the very first thing that a sports fan in Ontario can look for are the logos of both the AGCO, which is the Alcohol Gaming Commission of Ontario, and IGO, which is iGaming Ontario. Those are the two regulatory bodies that provide oversight that operators like PointsBet Canada applied for licenses with. And so those two logos will give sports fans the comfort that they are playing on reputable sites and not those that are continuing to service the gray market in an unregulated fashion within the province.
Thanks, Nick. Dave with PlayOntario.com. As we've been talking about here, there's some people who will say, I've been placing bets for years online, maybe with a bookie. Let's talk about what changes here versus the gray market from a consumer perspective.
Well, from a consumer perspective, there's just so much more choice, and your bets are now protected. So the regulated means you have some government backing for your wagers. In the past, you really didn't know what could happen to your wagers in the gray market. So this provides greater consumer protection, greater consumer choice, and that's really the beyond the obvious of it provides tax dollars right back to the province.
And the great thing about having a market for this is competition. There's it's a healthy market when there's competition. But Dave, what does this mean for the horse racing industry? Fantasy sports, traditional casinos, going to the casino. What does that mean? What does it mean for them?
Well, it means competition, and certainly for the horse racing industry, which employs somewhere in the neighborhood of 25,000 people in Ontario, it's a challenge. We think that they'll be a part of this eventually, and that they'll be able to take part and offer their product as well. For the casinos, what we've found is that it's usually quite a different customer than the person who likes to go to the casino rather than somebody who likes to bet sports for, say, online. So we think it's just there's room for everyone in that market.
And this is a different kind of gambling, the online versus going to the casino. Nigel, this is what I want to talk to you about. We can't overlook the topic of addiction. It is an illness. What are your concerns from a mental health and addiction perspective when we consider the checks and balances or lack thereof when you talk about online gambling?
Well,
gaming?
From my perspective, I can see there are positive and negative aspects to this change. On the positive side, the regulated industry, you can ensure that people get information about a helpline, for example, in Ontario, which is not necessarily going to be available to people who are online of some gray market site. Possible information about treatment services on Ontario. So information that's specific. You can also require them to have harm reduction information on their website. So those are the positive sides of things.
Right, but
and we shouldn't overlook those.
Right, what would be the impact that, I mean, or what does the research say about someone struggling with addiction that they would make use of a resource like that if they see it on a gambling site and they struggle with addiction?
Well, I mean, one of the problems is that often people don't know where to turn for help, right? They, they're desperate. They don't know where to turn. So having that information available on their site, especially if it's on, if there's information in their account, then that can be a positive thing. It gets people information about services, help resources. Now, on the negative side, whenever you increase the availability of gambling and the marketing for gambling, you have the potential of increasing the number of people who could develop a problem with gambling. So that's the negative side. And it can be quite a serious problem. People will spend money they can't afford to lose. And most people who gamble don't get into a gambling problem, but the people who do get into a gambling problem can have enormous losses, enormous financial losses, jeopardize career opportunities, marital breakups, suicide is another common consequence. So getting that information to people who are in crisis is an important step. But also having information on these sites about the odds, for example, about the counteracting some of the misinformation, some of the erroneous beliefs that people have, like the belief that, if I've lost, I'm then due for a win. So getting that information out to people is also an important step.
So it sounds like, yes. Oh, go ahead.
So I have, as I said, I have mixed feelings. Because it's likely to increase the number of people who are gambling. I mean, that's the whole point, right? To make more money. And that has the potential that some people are going to get into gambling problems. But there already are a lot of people who are gambling at the gray, non-regulated market sites. So it's not as if we're going from zero. We're going from a pre-existing issue. But the legitimization of this and the advertisement for gambling is likely to cause an increase in the number of people who gamble, who are gambling online and on sports.
Okay, so I think the panel overall agrees, despite how you may feel, regulation is a good thing. There is some checks and balances and some accountability in place. And on that note, jobs, Nick, Dave, want to ask you, and thank you, Nigel, if we can talk about two things for you both here. Nick, we'll start with you. What does this mean for jobs, and who do you think your main competitor is?
Well, those are two very, very different questions. We'll hit the second one first.
We got 30 seconds each for you and Dave. So go ahead.
As far as our greatest competitor, ultimately we're excited to attack the market and bring our best-in-class technology platform to the Ontario sports fan. And as far as jobs go, it's incredible. We have PointsBet Canada has dedicated ourselves to building an authentic and genuine sports betting brand within Ontario. We are closing in on 50 employees within our Toronto headquarters. And the amount of job growth that we're going to see over the next calendar year is going to be quite significant, especially for PointsBet. So I think that I think this is just the beginning of an incredible regulated market, where I will just want to add one thing, that the goal really is to repatriate the gray market sports better into the regulated framework to offer those proper consumer protections like deposit limits and time limit and spend limit and self-exclusion. Those things are ultimately at the top of the list of any regulated operator's priorities.
Yeah. Okay. Thank you for adding that, Nick. Dave, I mean, what does this mean for jobs? At least 1,300 in Ontario. Is the main competitor here, is it online gaming versus the gray market, or online gaming versus, the horse racing industry? What is it? These are obviously two very different things.
Oh, that's a tough question. I think it's more a case of versus the gray market, and those are jobs that we're bringing here. So whereas a lot of those gray market jobs are offshore and not taxed and regulated, those 1,300 jobs, and that's just the beginning. That's just an estimate of sort of on the low end of what this market could bring to Ontario. So we think that's a positive that those are additional jobs here in the province.
Okay, Nick, Dave, thank you so much. All the best. And Nigel, thank you for this important conversation. Of course, if you're out there and you need help or you know someone who does, CAMH has resources and offers support. So thank you for that important conversation as well. Thanks to our panel tonight.
But for workers out there, they can know under Premier Ford that the minimum wage is going to go up every October. And again, it's important that we build back a better Ontario for all workers, rebalance those scales. That's why we continue to ensure that we're bringing in more opportunities for workers so they get more paychecks, bigger paychecks, and more opportunities and more workplace protections.
Ontario Labour Minister Monty McNaughton announcing today the minimum wage is going up 50 cents to $15.50 an hour. In his comments today, McNaughton said the government wants to improve conditions for all workers. 4 years ago, back in 2018, Premier Doug Ford scrapped the province's planned increase laid out by the former Liberals just 3 months after being elected. At the time, Ford said raising it would hinder job creation in the province. Today, the Ford government is now telling Ontarians that a 50-cent bump is coming this fall. For more on this, we welcome to CP24 Tonight Ryan Mallow with the Canadian Federation of Independent Business. Paul Taylor is the Executive Director of Food Share Toronto. And Craig Pickthorn is with the Ontario Living Wage Network. Thanks to all of you. Craig, can someone here in the GTA comfortably live on $15.50 an hour? I mean, what does that look like?
Great. That means that you're going to be short by $230 per week. That's how much the living wage, or the minimum wage, is short of the living wage in Toronto.
How do you come up with that number? Explain that a bit more.
So we look at all the major and minor expenses that a worker would face. We look at, obviously, the big one would be shelter, then food, transportation, and childcare. We also factor in any government taxes, transfers, or benefits. And what you get at the end is a living wage. So for Toronto, the living wage is $22.08.
Okay, so Paul, let's bring you in on this. Explain what Food Share estimates is a living wage for people here in Toronto and what your company's doing about this.
Yeah, the living wage is far more than $15.50, which has been proposed. You know, when I saw this announcement, to be quite frank, I thought more of way too little and far too late. You know, Food Share, the charity that I work at, is an organization that's committed to doing everything we can to support healthy workers, and that includes, and healthy communities, and that includes paying a minimum wage that is a living wage. It's unconscionable that we have governments that are legislating people into poverty by not paying wages that we know allow people to live, not to mention folks on income supports like welfare and ODSP. It's actually quite awful, the situation in this province and what folks are forced to navigate.
Okay, so Ryan, the money has to come from somewhere. So how are business owners feeling about this today? And will the cost of this wage increase be then passed on to consumers?
So I think traditionally when we see a minimum wage increase, that is what happens. Business owners do look to pass on the cost. That is going to be a little bit more difficult than it has been in the past because business owners have had to do that throughout the pandemic as they waded through various periods of lockdown or restrictions. A lot of the elasticity in prices that was there is really gone. I think important to note about today's increase, though, is that this was expected. I know it sounds like it's a bit of a new idea, but the minimum wage in Ontario has been indexed to inflation since, I believe, 2014. The Ford government put a bit of a pause on it after the jump to 14 under the previous government. But we have seen this is the third inflationary increase during the pandemic from 14.25, 14.35, now up to 15.50. So I think this was expected. But that being said, wage pressure is another profit insensitive thing that business owners have to deal with. And again, there's not a ton of profit to go around to reinvest right now.
So, Ryan, can you talk a bit about what you're hearing from Canadian businesses, how they're prepared here in Ontario to burden this cost?
So I think we're hearing from businesses the same thing that we're hearing from people. The cost of living is up. The cost of business is up. It is all about affordability right now. Amongst our membership, we are seeing record highs in terms of wage increase intentions. We know that finding labor right now is incredibly difficult. And a lot of business owners have tried. Half of the business owners that are experiencing a labor shortage have tried upping wages to attract new employees, and only half have found success in that. A lot of times they just can't find the person. So I think that, you know, wages are part of it, but there's a lot of affordability conversation to have going on, and we do want to see what the government is going to do to lower the cost of doing business as much as we're looking at the wage side of the equation on the cost of living.
Okay, so Craig, Ryan just mentioned he sort of saw this coming. We haven't seen an increase for some time now. How might this impact people who make slightly above the minimum wage? I mean, could this have a trickle-up effect?
I think so, because one thing that's much different about the living wage is that it comes out every November. The first Monday of every November, we announce living wage rates. So that's one way that it's different. And you speak about the trickle-up effect. I think that anytime you raise the wage of the lowest earners, it benefits the whole community. This is a well-known fact.
Paul, I want to just mention things that your company does, that your charity does. You know, paying $22 an hour and also paying people who come in for interviews. Why implement things like this?
You know, I think it's really, and maybe I should correct also that we pay a minimum of $24 an hour. We pay a minimum of $24 an hour, and when folks come in for an interview, we also pay for that. We pay $75 an hour because we think, again, we have a commitment and a responsibility to doing everything we can to create healthy people and healthy communities. And we wish that our governments felt the same commitment. And I just want to respond to something that was said earlier, and it's that, you know, there's not a lot of evidence that suggests when wages go up that, that the pressures make it unbearable. What ends up happening is that people, low-income folks, have more money to spend, and they're spending it in their local communities. So I think there definitely is a trickle-up experience that happens when we increase wages. So it's time to really get on with it in a big way.
Okay, so let's talk about this narrative, because this is something that came up, you know, several years ago, the last time we saw an increase to the minimum wage. Ryan, we know the pandemic was challenging for so many people, and that's part of the reason this announcement was meant today. But are you concerned that this could be a job killer, or what kind of impact could this move have on jobs and the economy?
So I'm not quite sure about job killer. I know that we've seen in the past that hasn't necessarily materialized. I think perhaps a job changer. Certainly things around hours worked, and business owners do have to wind up making adjustments. We do tend to see price increases as well. The difference, of course, this time is we've never come off of a global pandemic before. The average Ontario small business is in $160,000 of COVID-related debt, regardless of any other debt that they might have been carrying before that. You know, here in the city of Toronto, some industries were shut down over 400 days, and that's to no customers at all. So it's a very different setting coming out right now. And again, anything that impacts affordability or adds cost pressure is going to exacerbate recovery and the difficulty, the uphill climb for recovery for a lot of small businesses.
All right, we have to talk about the timing of this too. Of course, we're 2 months away from an election. The NDP and Liberals promising to further increase the minimum wage if they take office to $16. How much of an election issue is affordability? And Craig, what would you like to see policymakers do to address this?
Well, one thing, it would be further, the Liberals mentioned they want to examine looking at a regional wage that's tied to the local expenses. I can save them some trouble. We already do that in 27 communities in Ontario, and we add more every year. One thing that we noticed last year that affected our living wage rates was the introduction of a childcare subsidy. And so it really showed how much of an impact collectively we can have on affordability. So that's what I would say.
Paul, any additional thoughts and your opinion on this idea of a regional minimum wage?
Yeah, I think a huge kudos to Craig and the work of his organization. FoodShare certainly benefited from that work. Thank you, Craig. The reality is affordability is affecting everyone, and obviously it's affecting those with the lowest incomes the most. And I think it's important to also recognize who those folks are. Those are low-wage workers, those are also folks on social assistance and ODSP. The majority of them are women, they're young people, they're immigrants, they're Black, they're Indigenous folks, and they're people of color. And we live in one of the richest provinces in a rich country. We shouldn't have to beg and shame our governments into doing what's right.
Okay, Ryan, I'll give you the last word here. You know, we're talking about businesses that you've mentioned have suffered so much during the pandemic and frankly struggling with affordability themselves right now. What do they want to see from this government in the next couple of months during the election? What are they looking for?
I think the key is addressing that affordability. And of course, affordability for people affects affordability for business too. If we are pricing employees out of working in Toronto, it makes it very hard for a downtown Toronto business to be able to attract employees and bring in. So that's important. The other thing we'd like to see is, as a result of this, what has happened is businesses are having to hire underqualified employees and train them up. They're happy to do that, but that comes at a serious time commitment, a serious financial cost. We would like to see the government acknowledge that and provide a training credit as well, so we can get the labor force up to where small businesses need it to be to, again, get on that road to recovery and really get back to where we were.
All right, lots to follow here. A really important conversation. We so appreciate your time tonight. Ryan Mallow, Paul Taylor, and Craig Pickthorne. Thanks. The Ontario College of Family Physicians is renewing calls for the government to address a growing shortage of family doctors. Stats Canada reports 1.3 million Ontarians do not have a family doctor and predicts the crisis will worsen as many doctors approach retirement and COVID-19 related backlogs continue to strain the system. To discuss the problem and what can be done, we welcome to CP24 Tonight Kimberly Morin, CEO of the Ontario College of Family Physicians, and Dr. Sarah Newbury, a family physician in Marathon, Ontario. Thanks so much to both of you. Kim, start with talking to us about how bad the shortage is right now.
Well, it is very bad. It's a crisis. There's 1.3 million Ontarians who don't have a doctor right now. And from the data, we can see that this situation is going to get much worse. You know, we saw this exhibited, you know, in a really horrific way in the last 10 days when the emergency department in Red Lake closed because of a shortage of family physicians. Sarah, maybe I could ask you to talk about that situation.
Yeah, I'd be happy to, Kim. I think we often think about family physicians primarily being in their offices providing primary care, but across the north, family physicians provide a real breadth of services, including coverage in the emerge department and the inpatient wards of hospitals. So a shortage of family physicians in Northern Ontario can mean the closure of emergency departments.
And what does that mean for patient care, doctor?
Well, what I would say is to come back to the Red Lake example, it meant that patients who required emergency service had to be transferred by land to the next nearest emergency department, which in the instance of Red Lake is 2.5 hours away in Dryden. So there were patients who were transferred by land, by ambulance, to Dryden at huge risk in that instance. We know, too, that the communities of Bruce Mines and Thessalon will be without any family physicians at all as of April 18th.
So, doctor, it sounds like the people who are most impacted by this shortage are people who live in more remote communities.
I think that people are impacted by the shortage of family physicians no matter where they live in the province of Ontario. There are Ontarians who really can't access family physician services easily. But it is true that in the north there is a disproportionate challenge to accessing family physicians. We know that patients wait longer in Northern Ontario to see their family physician, and family physicians across the north are stretched quite thin as they try and provide care in their clinic, in their hospital, in their assessment centre, providing vaccines. It's a very limited resource and a huge challenge in Northern Ontario currently.
This is really troubling. You know, as Canadians, we feel really proud of our healthcare system. So, Kim, how did we get here?
Well, you know, it's really decades of really governments not paying attention to this crisis. And so we're here today really sounding the alarm for action. You know, the best healthcare systems in the world. We know that the attachment rates of family physicians to their populace are very high, and we're seeing that slip in Ontario quite substantially. And as you said, the problem is arguably worse in the north, but we see it all throughout Ontario. We know in the eastern part of the province, there's a significant issue. We know that in parts, even in urban areas, where there's particularly vulnerable and marginalized people who just don't get the help that they need. I would say, though, that there are solutions and there is hope. We've laid out a plan that we can make a difference here and that we can avert this crisis if we really get government to partner with us now.
Okay, I want to get to the solutions, but first, Dr. Newbury, can you talk to us about the toll this is taking, on physicians like you personally? We keep hearing about all this burnout. We know the healthcare system has obviously taken a toll, especially during the pandemic.
Mm-hmm. Yeah, I think it's a really important point. I think we know that burnout among family physicians has worsened during the pandemic. There are significant challenges to the degree to which we're stretching family physicians across the system currently. I think one of the particular challenges right now for rural family physicians is the obligation and the responsibility that they feel to their communities and to their patients. And so we know that for some physicians across the North, what they're experiencing is a real degree of grief, and some describe it as moral injury, in that they don't feel able to reliably care for their community in the way that they aspire to and have been able to, in fact, in the past. And that burden is a huge and significant burden for family physicians in Northern Ontario.
Okay, so let's talk about what can be done. Kim, we're around the corner from a provincial election tomorrow. We're going to hear the federal budget. What kind of policy changes are you looking for? What would help address the problem now?
Well, I think certainly that we're looking to help recruit more doctors into the system, but I think that for the physicians that are really overburdened right now, and Dr. Newbury really articulated that well, there's a couple of things that really could make an enormous difference. One is reducing the amount of administrative work that a doctor does. I think that everybody would be absolutely shocked about how much time a doctor spends actually behind their computer screen trying to manage through different computer systems, not talking to each other. And I think we've all personally experienced it. But can you imagine if you're a physician trying to see as many patients as you can and struggling with computer systems not talking to each other? We know that there's simple solutions that can be scaled up quite rapidly, and we'd be looking to get the government to help us do that. And the other part would be really embracing, I would say, working in teams. So family physician-led teams of healthcare professionals, working with nurses, working with mental health therapists. We know that when physicians work in teams like that, that care can be delivered faster to patients, and actually we can get them very high quality care.
Okay, interesting. So, Dr. Newbury, what's your take on that? Would this help to meet your needs? How can the province, the federal government, sort of better recruit and retain physicians like you?
Yeah, so absolutely the things that Kim has identified are really important. And I know that the OCFP has done a terrific job reaching out to family physicians to really understand what they need, and what Kim has described reflects what family physicians feel that they need in order to better serve their patients. I think there's a lot that we can do to better recruit and retain family physicians in the province of Ontario. Some of that is about training and how we train family physicians and prepare them for practice. Some of that is about how we support them once they're in practice to be able to do the work that they need to do in ways that they can feel good about. It's not just about providing care. It's really about providing the kind of high quality care that all patients should expect, and that really makes practicing medicine feel meaningful and rewarding every day. And I think if we can create a system in which family physicians feel supported to provide the best care that they can to the populations that they are here to serve, then we will have done a truly terrific thing for retaining the family physicians that we have currently.
Okay, Dr. Sarah Newbury and Kimberly Morin, thanks to both of you for your time and your insight. And Dr. Sarah Newbury as well, thank you for your work.
Thank you very much for the invitation to be here.
The Trudeau government has tabled its second pandemic budget. Finance Minister Chrystia Freeland stood in the House of Commons this afternoon to present the spending plan. It's the Liberals' first budget since making a deal with the NDP to stay in power until 2025. It features multiple NDP priorities such as dental care, building more homes, green jobs, and a tax on excess bank profits. It also includes $500 million in additional military aid to Ukraine. Well, federal spending falls to $452 billion in the new fiscal year with a deficit of $52 billion. Well, he's had a busy day, but he's taking some time to join us now. Joining us live tonight from Ottawa, CTV's senior political correspondent, Glenn McGregor. Glenn, thank you so much for being here. So let's get right to it. Housing affordability here. This was a big theme. It's a big concern here in Ontario as well. Is this housing package here a lot of fanfare and little in terms of impact?
A lot of little initiatives there, Christina. Things like a ban on foreign residents from buying property in Canada for 2 years. There's also a new tax on people who flip houses, that is, buy a house and then sell it again within 12 months. But there are some exemptions for that. If you have a job change or you have a new child or a divorce, that would be waived. And then there is this tax-free savings account, kind of like a mix of a TFSA and an RRSP, that allows people under the age of 40 to put up to $40,000 into this account, take it out with without any tax penalty, and use that for a down payment. But people who are experts in the housing markets and real estate tell you that that's just going to create more demand. And the problem is not demand. There's lots of people, as you know, especially in the GTA, who want to go out and buy houses. There just isn't the supply. There isn't the inventory of new build houses or existing houses that are on the resale market, and that really is the problem. Now, there are some things in this that may help alleviate that a little bit. There's a housing accelerator, but that's mostly aimed at affordable housing. But I think the government is kind of saying, and Chrystia Freeland today admitting, there is really no silver bullet to this, and there's not one that the federal government has, because this is really a problem in the marketplace, and they just don't have the levers, Christina, that they can pull to make any sort of dent in this rising cost of housing right across the country. Yeah, I'm going to get to supply in just a moment with you, Glenn, but Chrystia Freeland had said, the finance minister, that this is a realistic budget. You're not going to be able to wave a magic wand and then here in Toronto you're able to afford the home you want in the neighborhood you want. She says, nor should the federal government do that, nor do they have the capacity. Their role is to eliminate barriers to making housing, more of an opportunity here for people. But Glenn, are you concerned about some potential loopholes? I mean, this ban on foreign home ownership for some, not everyone. We look at foreign home ownership here in Ontario. It's only about 3%. And then when we look at this, you can't flip a house within a year unless, you get divorced or you move for a job. Well, then can you flip your house at 13 months, 14 months? I mean, are people just going to look for the loopholes? I can't imagine the kind of loopholes people are going to try and exploit. Maybe people are going to have children so they can flip their house and make a huge amount of money. Or maybe they'll get divorced, so they can sell their house. I think there's some unintended consequences that are potentially at play here. But look, this is small ball. This is not really going to make a big difference. The foreign ownership also probably, as you say, 3% in Ontario, maybe slightly higher in the greater Vancouver area, because you have a lot of Hong Kong money that came there in the late 1990s. But really, this is not going to address the problem. On the question of other things that could be done, is there zoning things that can be done? There's been some talk about helping municipalities and provincial governments as well change zoning laws so that disused office space, and there was a lot of that because people are increasingly working from home, not just from the pandemic, but just moving in that direction generally. Maybe those things can be converted into either affordable housing or just regular, market-based housing. But again, small steps that aren't going to make a huge difference, probably and certainly not in the short term. Probably not even in the medium term. Okay, that's all the time we have. Thank you, as always, CTV's Glenn McGregor. Much appreciated.